As with any medical treatment, individual results may vary, and this experience is unique and specific to this patient only.
Life on a farm is very relaxing and very busy. It's a lot of hard work, it's a lot of physical work, but it's very rewarding. A typical day starts before the sun comes up. I feed cows and horses, and then I usually go for a run. Right now, we're in the middle of finishing up mowing hay, so all the things that go along with that, being on the tractors and raking and moving bales. I am on my feet from the moment I get up until I finally go to bed. There's definitely a physical benefit to staying active. As long as you keep moving, you're doing well. I really believe that. I've had bunions as long as I can remember. You first notice it because your foot is sideways. You can see it. Your shoes get indented. It can create a change in your gait, and it can affect your balance. The pain on my left foot created by the bunion started very slowly, and then quickly it made it impossible to run. It made it very difficult to continue to do daily activities. It was very frustrating because you get in a habit and a routine. You can't break that routine. In September, October of 2017, I was training for a marathon and my feet hurt so bad. I took a lot of ice baths, I got a lot of massages, nothing worked. When it got so painful that I had trouble walking, I knew that something had to be done. I decided I would need to seek medical treatment. When Dr. McAleer described the Lapiplasty procedure, he explained that it would be actually repairing the root of the problem.
April had a significant amount of what's known as frontal plane rotation. That's where the metatarsal has spun out of position and needs to be put back into alignment properly. A two-dimensional procedure just wasn't going to provide an adequate amount of correction for this problem. Once we started talking about 3D, Lapiplasty, we came up with a great plan for April.
There are so many things that you don't realize you use your feet for until you can't. I was very relieved that there finally was a solution. It wasn't the end of the world after all. My Lapiplasty was performed on December 21st, 2017, and it was on my left foot.
April had a very typical, non-complicated post-operative recovery, and she was able to get back to doing the things that she loved.
I was able to start feeding cattle within a couple of months, and then was able to wear a pair of high heels on Easter Sunday. I have no pain from the surgery. I have no pain where the bunion was.
I'm excited to say that since we've completed April's Lapiplasty procedure, she's returned to running, and she recently completed a marathon in Alaska, where she finished in the top 10% of all the runners.
Today, I feel fabulous. I ran a half marathon 3 days ago, and I'm back to training for another full. It's all back to normal. Because of the benefits I received from the Lapiplasty procedure on my left foot, I have also decided to have the procedure done on my right foot in December. What I can share to anyone who hasn't had a procedure yet, the best thing is to do it now. Do not wait. You can have it repaired, and your chances are so much better of being able to have a normal life afterwards. I believe that as far as a bunion goes, the Lapiplasty procedure is the only way to go.
Only a surgeon can tell if Lapiplasty 3D bunion correction is right for you and what level of activity you can expect after healing is complete. There are potential risks with surgery, and recovery takes time. Potential risks include, but are not limited to, infection, discomfort from the presence of the implant, loosening of the implant, and loss of correction with non-union or malunion. Please consult with a physician for complete information regarding the benefits and risks associated with the Lapiplasty procedure.